After delivery, you will be cared for by a series of midwives and support staff. All staff will wear an ID badge so you can clearly identify who is caring for you. During this time, you'll be orientated to your environment and you will be offered pain relief as you desire. However, there are regular drug rounds to ensure that you remain comfortable. When it comes to being discharged home, the midwife will go through your baby check and also your check to make sure that you're both well enough to be discharged. Your baby will also need a newborn infant physical examination. This may be carried out by a paediatrician or indeed the midwife who is looking after you. If your baby requires a BCG vaccination, this will be given by a paediatrician. All information will be given to you prior to discharge in case you need to get hold of a midwife in any situation when you are at home.
In order to reduce the risks of sudden infant death syndrome, there are several guidelines that we would recommend. We don't advise bed sharing if you've got anybody in your family that is a heavy smoker, they're using any alcohol or medications that are going to make them exceptionally tired. Equally, if you are feeling so tired that you're going to fall asleep while you're holding your baby, that's when you lay them into the cot, or you have somebody with you to support you that will do that for you or look after your baby. So general guidelines to making sure your baby is sleeping safely are that your baby should be in your room for at least the first 6 months of their life, in a cot next to the mum's side so they're easy access for feeding. You lay baby flat on their back with their feet down to the bottom of the cot, that way they can't wriggle down under any loose blankets. When you're using loose blankets, you make sure that they are cellular type ones, hand knitted, crocheted, anything that's got nice little holes in because it allows for good airflow. They go across, nipple level no higher, leave the arms sticking out and make sure you get into the habit now of tucking them in the sides and around the feet of baby. That way it makes baby feel nice and snuggly without swaddling. It also means that as baby gets a little bit more physical and is kicking their legs around, they're less likely to be able to kick it up over their face. Easiest way to check baby's temperature rather than worrying far too much about thermometers, a couple of fingers down baby's front or back, whichever's got easy access. They will feel nice, similar temperature to yourself, they are fine. Okay, if you need to add extra or take away blankets, you'll do so throughout the night as it gets cooler. Area around baby's head needs to be completely bare, so no toys around, don't use cot bumpers, pillows. Baby will not need a hat on their head once you get home, although we do use them in the hospital. We want to allow baby to be able to regulate their temperature through the top of their head. Don't leave baby with a bib on, don't leave hairbands. It's essentially anything that can get caught around baby's neck, they can pull onto their face, they can wriggle their face into, that can block their airway. Prior to discharge, please make sure that you've had all the checks that we've mentioned previously. You've got any medications that you need to take home with you. You've been given a red book by the hearing screener, and you've either had that test done, or equally, if it wasn't successful, you've got an appointment to come back to have that done. You have a copy of all the leaflets that you will have been given on the ward, and also make sure that you've got our reduced car parking form as well. If you live beyond our area, your midwife will also provide you a printout of all your notes in order for the community midwives to be able to access those. Please make sure that you have them to hand because they will need them when they come to visit you. The day after you are discharged, you will be visited by a community midwife in your home. It should be somebody that you have already met from your doctor's surgery, and they will come to your home somewhere between 9 and 5. If nobody has arrived to you, however, by 4 o'clock, please would you give our helpline a ring, because it just means that we have time to send somebody out to you if there has been a problem. They will come, they will check mum and baby over, make sure all is well and that your feeding is going okay. If you've got any questions overnight, please jot them down, they will help you with those. Your next routine visit happens on baby's day 5, which is when we offer the newborn blood spot test and we will weigh your baby for the first time after delivery. We tend to discharge you from our care around about day 10, and that's when you'll be taken over by the health visitor who will make contact with you by letter. They will let you know when they would like to come and see you, they will come, they will weigh your baby again, and they will let you know what services are available in your local area and how to access them. They will also explain about the various developmental checks that they do, but they will be there for you until your baby goes to school. So any problems you have about weight gain, behaviour, development, social issues, please do see your health visitor because they will be there to support you. The information leaflets that you've been given on the ward has got all the information that we have gone through already. Please do make sure that you read them because you will find them very useful to refer to. Specifically at the moment, Your Baby and You, which provides everything about the general baby care, the safe sleep, feeding, and it also provides information for mums about pain relief and general wound care, keeping yourself clean, fresh and dry as possible, making sure that you're changing your pads nice and regularly. It discusses it all in here. If you've got any concerns again, you please just ask your midwives. We also provide you with information about group A strep, which is one of the more common infections in postnatal ladies. There's also a section here for the symptoms that you need to look out for. Generally pelvic pain and discharge and extra bleeding, but also things like flu-like symptoms. So please don't discount it if you just feel that you're getting a cold. Please just let us know. At the back of this booklet is a checklist of all the things that you need to arrange. You need to register your baby to get a birth certificate. We also do provide you with this information on a separate leaflet. You must make an appointment. You can't just turn up, and that appointment must be before your baby is 6 weeks old. If mum and dad are not married, it must be an appointment that you can both attend together for you both to be on the birth certificate. If you are married and it's more convenient though, one of you is legally allowed to sign for both. Also, when you have done that, you need to register your baby with your GP surgery. You are welcome to register with whichever surgery you want. You will need to fill in a normal new patient registration form. If you take the red book with you that the hearing screeners gave you, you will find it much easier to complete this form as all the information is in the front of that book. You also need to book a 6-week postnatal check with your GP, where mums, you will get checked over to make sure that you are feeling well, you have recovered okay, but babies will also have a repeat paediatric check the same as they have had here. This is very important that that is done, so please do make sure that you book that appointment yourself. Also on this list, we mention about mum booking a postnatal smear test after 6 weeks. This is to ensure that you are on schedule. However, if you have had a normal one within the last 3 years, then you don't need to worry about this at this point. Wait for your normal letter to come through. Outpatient appointments, diabetes checks, also on this list. Again, only if that relates to you, otherwise don't worry about it. And we also mention here, and don't forget, a reminder of our helpline number. You're going to ring that tomorrow if you've got any concerns, but equally, if at any point you've got any queries about mum or baby, any concerns, you will get a midwife on the end of the phone, day or night. On the page under the safe sleep information, you will find bits about making sure that your newborn remains well. We do include it in here because sometimes it's slightly different with a newborn as to an older child or adult, so it's worth reading through this list and making sure that you're aware of the things to look out for. The top section would be things you would probably ask for a GP appointment that day if your baby seems unsettled, they aren't feeding, they are less responsive, their nappy output does not seem correct, they have a funny colour, they're just not handling as you would expect. At the bottom, you'll be calling 999 if your baby has stopped breathing, if they are fitting, if they're vomiting green fluid, they are totally unresponsive, and please do look up about the glass test for meningitis rash as well, so you're aware of how to do that. If you are worried about meningitis in any way, you are calling 999. We also provide for you a booklet called Guide to Childhood Illnesses. It covers everything in here from the common cold down to meningitis. It's a good resource to keep with your medicines for the years to come, and again at the front is a list of signs of a serious illness as your child gets older, so it's a very useful one to refer to. We also provide you with an exercise leaflet that will be tailor-made to your delivery type, be it vaginal or caesarean. Please do make sure that you have the correct one. It provides you the information initially on the exercises that we recommend you do straight away. Deep breathing, circulation and pelvic floor. If you're unsure on how to do any of those, please do see your midwife. It then moves on to further information about pain relief for yourself and how to keep yourself comfortable. And then on to stomach exercises. Not yet. About 6 weeks down the line, you can start thinking about tightening up your stomach muscles, and it explains how to do that. There are certain situations where you may have been given information by a physio for specialist exercises. Please do those if you have been advised to, otherwise this is for all the rest of you. Normal exercise 2 to 3 months down the line before you start thinking about anything too strenuous. We also give you a bit of advice on when to recommence sexual activity. We do recommend that you wait. Ideally, we would suggest when the GP has signed you off at your 6-week check. However, please do make sure that before you do anything, you've had some contraception advice, and we do give you that as well. We have a little bit of information about all the different contraception methods that are available. There are some that aren't suitable with breastfeeding, so please do make sure whichever method you have decided is suitable for your feeding type. Your midwife or your GP will be able to advise you on that. Also in your pack, you have been provided with a feedback form. There are specific ones for each area that you have been in, so you may be asked to fill in more than one, and it will give you the area at the top so you know which information you're giving us. Please do take the time to fill this in. We would really appreciate any information that you can give us. It's anonymous, we won't know it's from you, so say what you need to say and it goes in the box on the desk before you leave. One of the information leaflets we give you is provided by the RSPCA, and it explains how to safely introduce pets both in the home and the wider area to children and vice versa, to make sure that children do not come to harm from animals. Thank you very much for listening. Before you go home, the midwife will come and inform you to let you know that you are free to go. But we would like to see your baby strapped into your car seat. So as you physically leave the building, please just stop by the desk, any member of staff can check. First of all, we'll be making sure that baby is wearing the most appropriate clothing. So always make sure that you remove any outer clothing when you strap your baby into a car seat, and that will be the whole time until you're using a high back booster seat with the adult retractable seat belt. It's about age 4. They should always be wearing their normal indoor clothing. So you put your baby into your car seat. Ensure that the part that goes between the legs is right up against the nappy, that way baby can't slip down, and bring the shoulder straps over the top. Whichever method your car seat uses, strap it in and then pull nice and tight. You're aiming to have it tight enough so that you can just get 2 fingers between the straps and the baby, but you're not able to physically pull them away from your baby's body. That means in the event of an accident, your baby's not going to go anywhere. Also, when your baby's in the car seat, there are limitations to how long they can stay in there. 1 hour maximum before you take them out, good 20 to 30 minute break, and that is due to the positioning and their airway. For that reason as well, we really don't recommend that you use them anything but a safety aid in the car. Not on wheels around town, not in the supermarket trolley, not in the house. Hold your baby, prams, slings, Moses baskets, carriers, all far safer than using your car seat for anything other than your moving car. Thank you again. Please just remember you have a community midwife coming out to you the day after discharge, and you've also got the helpline number 01733 677266. If you need any help, you give us a call. Antenatally, you're given a lot of information about making up your bottles. You get given this guide in your pack. It might be something that you discount if you've chosen to bottle feed, down to the fact there is quite a lot of information about breastfeeding in it. However, please do have a read, because in the first few pages it does talk about making up your formulas as well, and it also points you to areas of other interest. You have the guide to making up breast milk that you can get from UNICEF. We have a copy here you can download off the website, and you've also got information about First Steps Nutrition, where you can get all sorts of details about making up formula, how to go out and about from home, how long flasks stay hot for different sizes. Anything that you might find interesting will be on that website. It's the only organisation that gives information that isn't sponsored by a formula company, so they are charity-based, non-for-profit, so they'll tell you exactly what you need to know. Baby only needs first stage newborn milk, and that is the whole way through until they are age 1. You don't need to consider moving on to Hungry Baby, anti-colic, or any of the other versions of growing up milk that the brand may provide. Stage 1, newborn milk until age 1, and then you can start moving to a cow's alternative milk from age 1 onwards. For the first 6 months, all your baby requires is that formula milk. They will not need solid food until they are 6 months onwards. You can then start introducing a little bit of cow's milk with the diet, but you will still find that your formula milk will be the main source of nutrition up until that age 1. When making up your formula bottles, you'll need some form of steriliser. In the hospital we use cold water sterilisers, which are perfectly fine to use at home. You can also buy steam, electric, microwave versions. Whichever one you have, make sure you read the instructions so you're fully understanding how to use it. You need your bottles, you'll need a kettle for hot water, your powdered formula. You can also buy ready mixed if you find that easier. Powder tends to be the cheapest option when you're buying in bulk. So you have your bottles ready sterilised. When you're ready to make up your formula, with clean hands, get your bottle out, and you have your teat in here as well. You have the kettle that is boiled. Once it's clicked off from boiling, leave it for around about 10 minutes so it cools down from boiling to about 70. Pour the volume into your bottle so that you have the right amount that you've chosen to make from your information on your powder. Your powder then comes with a scoop. You need to make sure that you're using flat scoops, not peaked. Make sure that you've got enough to fill it, and then you put that on top into your boiling water. You put your cap on and you give it a really good shake to mix it. You must make sure that it is fully mixed, because otherwise you can end up with little lumps inside, and then that can cause an issue with baby's tummy. You must always put the water in first with the powder on top, because that way it will also mix properly, and the hot water will sterilise the powder to make sure it's safe for baby to drink. Regardless of how you feed your baby, it's a very important process in bonding. Plenty of skin to skin, eye contact, cuddles, responding to feeding cues. You're looking for baby licking their lips, sticking their tongue out, starting to make a noise, starting to wake for feeds. They're all very good indication that baby's going to be hungry. The technique you use to feed baby is very important. It's called paced bottle feeding, and you can find YouTube videos online which will explain how to do it. It's not very difficult, however it does make it much easier for baby to pace their feed, to control how much they're taking, to avoid overfeeding and to avoid getting too windy. When you take your bottle, you need to make sure that the teat itself is filled with milk. It does not need to be the whole part, just the nipple end. When you come to baby, they should be held more upright. You quite often see people feeding like this, but the baby can then struggle to feed. So more upright. You tickle the top lip with the teat of the bottle. As baby opens their mouth, you introduce the bottle down to the flat end, therefore baby can control the feed. If you start feeling them pushing it out, you can then give them a pause, you can then stop, give them a wind if they needed to, and then you can return to the feed. Again, tickle to the top of the lip. If baby doesn't open their mouth, that's usually a good indication that they're not interested. So tickle the roof. As they open their mouth, introduce the milk. If they stop sucking, you give them a pause, try again. Babies do not need to eat the same amount of milk every time. We don't eat the same food every meal, they don't either. So long as roughly across the 24-hour period they're getting the suggested amount for their age, each feed can be a different volume, so don't try and force feed them beyond what they're wanting. When you're bottle feeding your baby, it's very important to limit the number of people that actually take part. One, from a technique point of view, it helps babies avoid gas and wind, but equally because they're using that as their process to bond, mum, dad, maybe one other that's going to be feeding baby regularly, and that should be limited. So rather than passing baby around, just keep that a close relationship with parents and baby.
To bath your baby, if you wrap your baby in a towel, nice and secure, and then start first of all with your baby's face. And if you hold your baby under your arm, head and neck supported, they feel secure. And then you can take cotton wool, some water on each cotton wool, and then wipe from the corner of the eye and outwards, just once, and then again the other side, sweeping away from the corner of the eye. You can of course wash baby's face with the cotton wool, and then whilst you've got baby like this, it's a really good place to bath and wash baby's hair. So make sure you have a spare towel available, and then you can dry baby's head. Ready to put baby into the bath. Always make sure you've tested the water first and that it feels like it's skin temperature to you and not hotter. And then you can support your baby, putting into the bath with your hand and your arm behind the baby's neck and shoulders. And then with your other hand, you're free to wash your baby with the water. And all the while they feel nice and secure. If you feel like your baby has had any wee or poo on the cord and you feel like it needs a little bit of a clean up, again, use sterile water, which is boiled first in the kettle and cooled down. And then with your cotton wool, with the water, you just sweep around the base once and chuck that cotton wool and use another fresh one. Doing one sweep around the cord and away.